Uh, you're most welcome to our first in the series, sixth series of consumer justice and protection. You are most welcome. We launched this series some time back and promised that we will be bringing you on board so that we start deliberation on all these issues. So today we are starting the activities with regards to leading you through consumer justice and protection through mass media. We, colleagues, you'll appreciate and understand that most of our activities now, we use the media reach to reach out to you. The fourth estate as ears, mouth, voices, and eyes of society to reach out and use your respective platforms to amplify the issues that you learn from these media reach, and also give us feedback from the respective engagements that you have got with consumers on a daily basis in your respective media establishment, and also when you engage with duty bearers, when you engage with service providers, you are able to raise the number of issues that consumers share with you, and those issues that we share with you through the media lead. You are in position to speak out on them, and also trigger discussions and trigger many other engagements. So, ladies and gentlemen, you are most welcome to our first in the sixth series. Today, we are focusing on health. As you have seen, the poster. The topic is on consumer justice and consumer justice and protection in the health sector, health care service delivery. And the question is all the discussion focuses on, do patients' rights matter to realize consumer justice and protection? And many of you, you responded to, as you were registering, you responded to a number of or a few questions that were put up, and sharing views. And my colleague Ronette in the research and knowledge management has shared with us the dashboard on the issues, the feedback that you have given us. It is quite rich, and one of the aspects that are in there, a few things show that patients' rights are being challenged, and the health sector delivery needs to play its role to improve in a one way or another. As some of you are satisfied with the service delivery, and others are cautious about a number of things. So, ladies and gentlemen, you are most welcome to our first in the series. We are going to have another 5 of them, but this time we are focusing on healthcare service delivery and asking ourselves, do patients' rights matter to deliver and to realize consumer justice and protection? So, colleagues, with all the webinars that we have held together under our flagship, the Media League by Consent, we would like to thank you very, very much, because the products that are coming out of this initiative, because we are hitting around about 28 webinars. But when I look at the reporting when I look at the products that you're sharing with us that come out of these media leads, I am greatly and grateful to you that the information we are sharing with you, you are utilizing it to empower many other consumers out there through your respective media platforms. So I would like to thank you very much. Let's continue engaging. Let's continue reaching out, and let's continue using these resources that you get from the Consumer Center to empower as many consumers as possible. You reach the last mile, always keep up reaching there. You interview service providers, raise the consumer issues, catalyze discussion. You talk to the duty bearers. You talk to the local government duty bearers. You talk to the national duty bearers. Ask the regulators, ask the ministry, departments and agencies, the consumer issues. Take the consumer issues to the table. This morning, I have been in at the Uganda Bankers Association. They were releasing a report on cyber security, fraud, and there were aspects of consumer protection. And I was greatly honored and happy to see that consumer protection, consumer care, consumer satisfaction, and quality of services taking center stage. When you see issues that are affecting consumers in a respective sector, today we are talking of health. Next week we will love to either to talk about transport and financial services. The other week we would love to talk about food safety, talking about markets, talking about energy, talking about issues to do with the environment, health. What are the issues in agriculture? You know, colleagues, you are part of this discussion as you are the center, the epicenter of consumer protection, where you reach out and table issues on that are affecting us, the consumers. We are all consumers, but you are at a vantage point as the media to raise the voice, to speak on behalf of the 45 million. We can't reach 45 million as a consumer center, given the limited resources we have. But you, in your big numbers, like we are now at 60, we might reach 100 shortly. Once you reach out on your platforms, those of you who do MSCing on functions, you reach thousands and thousands on a daily basis. Those of you who are on electronic media, the digital social platforms, those of you who are in print, you reach millions on a daily basis. Once you raise the bar and speak out on these issues, you are playing a noble cause. You are playing a role in observing and realization of some of the objectives of the Ugandan Constitution. But that, apart from that, you are playing a role in realization of the United Nations Consumer Protection Guidelines, aspirations. So you might be playing a role locally, but you are also contributing nationally, on a continental level, and at a global level. So can we take on aspirations that are global, localize them, and send them to the last mile, speak on behalf of the consumer who are vulnerable due to challenges of poor service delivery, poor product quality, and safety. You speak out, raise the bar, and we put the duty bearers to notice to improve goods and service delivery. With those many words, I would like to welcome you all. And at this point in time, I would like to call upon my colleague, Bernard, to come in and share a number of aspects that he has prepared for us at this session, and be in position to deliberate on them a little further. Lastly, I would like to thank all our partners at Consumers International and the Unfriending Fund of Consumer 10 Bond for coming in to support us in this endeavor of empowering the media through the Media Lynch by Consent. So, ladies and gentlemen, you are most welcome. And Bernard, the floor is yours.
Well, thank you, Henry, for the honors. And colleagues, you're most welcome once again. I know that we've taken quite some time to start, but I'm going to be a little bit faster, such that we end our meeting at the right time that we had agreed to end it. But I can guarantee us that it will be something worth giving our time. Allow me to share quickly my screen such that we are able to have a quick reflection. Okay, here we go. Okay, so colleagues, once again, you are very, very welcome. And for today, we've been discussing so many things, but for today, we really want to dive into the consumer safety issues, but within the healthcare service or services. We also want to explore the rights of the patients. I know that there are quite a number of things that I keep sharing with you and my colleagues here relating to consumers. Now, today we are basically going to focus on consumers of health services. And so in the presentation of today, we are basically going to explore the rights of patients globally, but also focusing more on our context in Uganda. So let me, just before I go far, let me just be sure that my voice is very okay. Let me just first be sure there. Let me first.
Your voice is very good.
Wow, okay, cool.
And please go ahead.
Okay.
If you do any other act that might disrupt it.
Okay, fine. All right. So we're going to basically dive into reflecting on what are the patient rights and what are the patient responsibilities. Now, we're going to first look at the global context, and then we dive into the localization agenda, looking at Uganda specifically. What do our laws say about patients? And then we can analyze and see what is really happening when you fall sick. Is your service provider offering you a good service based on on what you're going to look at? And of course, giving us a little bit of a background on why we are interested in this subject matter, especially safety of consumers when they are receiving healthcare services. You will actually learn that 1 in every 10 patients is actually harmed in healthcare setting. You come from home, you're sick, but during the course of time, while you're at the hospital or to the journey to the hospital or back from the hospital, or during your admission period at the hospital, you end up getting harmed. You're not getting harmed because of anything, but because probably your rights are not being taken care of, or you don't know, or even you're not doing your part as a patient. So globally, we see that every 10 people who go to the hospital or who are seeking health care, actually 1 in every 10 are actually harmed. Some of them actually get what we call hospital-acquired infections. So you've gone to the hospital with a particular disease, but you come back with another. And surprisingly, over 50% of these challenges we see in the hospitals are actually preventable. So most of the harm we get in the hospital, half of them are actually preventable. And the other surprise that WHO reports is that 3 million people die every year just because of unsafe care across the globe. Just imagine 3 million people dying, but the cause of death is just the unsafe care. Someone has gone to the hospital, but they end up dying because the care being given to them is actually not safe. We've seen the media report on a number of, report a number of hospitals or healthcare where the equipment, some of them are rusty, some of them, and all those could contribute to harm to the patients who are actually receiving these services. So we have over 3 million people who die every year globally just because of unsafe care, And now because of these problems, the World Health Organization came up with a charter, and it's a patient safety charter. Now this charter, it's basically aimed at, it documents patients' rights, especially in the context of safety, but also it promotes our safety as consumers when we go for health care. And of course, it is hinged on a number of international human rights, also a number of standards, to make sure that everybody, everywhere, regardless of your age, regardless of your gender, regardless of where you come from, your race, your ethnicity, the language you speak, or the religion you belong to, or whether you are disabled, or maybe you are poor or rich, irrespective of all these status, this charter provides these different rights for all of us. And therefore, it is important for us to know them, especially the media, such that we can spread out to the masses out there and we alert them about the patient safety rights. And of course, the WHO, developed this patient safety rights charter as a kind of a resource to support the implementation of the Global Patient Safety Action Plan. Can you imagine that we even have the Global Patient Safety Action Plan? It runs 2021 to 2030, but this action plan is basically towards eliminating avoidable harm when we seek healthcare. So we have this Global Patient Safety Action Plan, which you can look up. It's a very interesting document that speaks to all of us on how best we can eliminate avoidable harm when we are seeking healthcare. Now, this charter also integrates, of course, other aspects, things to do with, the patient and family engagement. If I go to the hospital, my family should be able to engage me. I should be a family, and then it brings other aspects to do with, equity, dignity, access to information in the hospital setup, risk management when I'm in the hospital or when I'm being driven to the hospital. And also it goes into the core principles and the practices of patient safety. How do we make sure that the patients who have come for healthcare are actually safe? So this charter and also the action plan, they spell out all those aspects. And then, of course, it emphasizes the importance of delivering safe and quality healthcare, meaning that it goes into the details of why we must assure safety, why we must assure quality while we are providing healthcare services to consumers. And of course, the charter is a prerequisite of many of us, whether you're in media, whether you're a family member, whether you are, all of us are actually talked about in that charter. Now, the Patient Safety Rights Charter spells out 10 patient safety rights. I am not going to so much go into this because this is the global. I just wanted to first give you a global perspective where we're coming from. And also, I have added in the corner here the call for adoption by countries. Now that we're talking about Uganda, I am going to focus more on Uganda, but Uganda is speaking from the global. So the WHO has this charter. The charter provides 10 patient safety rights and then a call to action to other countries to actually adopt. So for our case, of course, I'll do more of the Ugandan context, but I wanted to provide this information to you so that you're aware that we have the 10 patient rights. Of course, the right to timely, effective, and appropriate care, a right to safe health care processes and practices, which I'll dive a little bit into that, the right to qualified and competent health workers, such that you don't just you find anyone in the hospital and is the one working on you, you have a right to qualified and competent health workers. We have a right to safe medical products. Now, the tablets we're using and all those equipment, how safe are they? It's our right to have safe medical products, but also their safe and rational use. There's a right to safe and secure healthcare facilities. So think about the healthcare facilities around you. How safe are they and how secure are they? They are not only talking about safe, but also they're talking about secure. So they can be safe, but are they secure? Alternatively, they can be secure, but are they safe? So we can look at that. So these exist, and we have all these documents in place, very small documents, and I think the media personnel, it would be very, very good that you look at the patient safety rights, and then you start talking about them on your programs. But also, we have a right to dignity, to respect, to privacy, and to confidentiality. Every patient requires that they are dignified. Every patient must be respected. Every patient must be handled in a non-discriminatory manner. Whether you are, from wherever, you must not be discriminated against. All patients have a right to privacy and they have a right to confidentiality. Now, these are global standards. These are global safety rights. We have a right to information, that every time you go to the hospital, you must be given information about the disease that you're actually suffering from. It is mandatory. Even when I prescribe medicine to a patient, I am supposed to provide information on which kind of medicine I am giving to the person. If somebody gives you 5 packs of medicine, I must provide you the information on what each of those medicines is meant for. I am supposed to provide you the information on how much of the medicine you're supposed to take per day. Even when I know that I'm supposed to write on the packaging material 1 times 3, I am supposed to assume that you are not learned, and so I must provide this information verbatim to the consumer. That is the right to information. I must provide you this information as much as possible. When I'm sent to the laboratory to do a lab test, when I come back with your results, I am supposed to provide information on the findings from the laboratory, and I tell you what the lab results actually mean. So it's really not that I should come to the hospital and I go to the lab and then that is all and the doctor prescribes medicine. No. I am supposed to be told what are the findings from the lab. What are these findings? What are they supposed to mean? What are they suggesting? Are they suggestive of malaria, or are they suggestive of malaria negative? Are they suggestive of positive HIV or negative? Are they supposed to mean that I have a cancer, or the cancer is growing or something? At what level is this cancer, etc.? Which type of cancer is it? Where is it found? Is it in the liver? Is it in the kidney? I must provide the patient this information. And when I'm given medicine, I'm supposed to be told that, hey, this is for headache, this is for malaria, this is for that. So a patient is supposed to be given that information. Now, away from this information, I'm also supposed to be given education, especially on what brings about this disease and how best can I prevent it, or how am I going to make sure that I cure from it. Now, that is part of education. So you are not just having a right to information, but you have a right to information coupled with education. So I'm supposed to give you this information, but I'm also supposed to educate you on these issues. So why do I have this disease? Oh, well, this is associated with your body weight, or this is associated with the food you eat, this is associated with the hygiene, this is associated with this. This is how we can handle it, this is how we can prevent it, and if you do A, B, C, D, and E, we can be able to prevent it, or we can be able to manage it. That is part of education. So every consumer out there, whenever they go to the healthcare unit, they must be provided with education about these things. In our setting, what we always do is we provide health education, as every time you go to the ward, or maybe you go to OPD, they're supposed to be giving you health education because it is your right to have this information. And of course, once you are informed and they have educated you, then you are supposed to be allowed or be supported in decision making, especially when it comes to the therapy that we are going to give you. A patient is supposed to participate in the decision making of which kind of intervention you're going to offer to them. If, for instance, a patient is supposed to be admitted, you must agree, the service provider must agree with the patient that, hey, we want to admit you for this disease because of reason A, B, C, and D. And so the person is able to make a decision to be admitted or not. Even when you're supposed to be admitted, you can still refuse to be admitted because probably you've left your children home and they don't have a caretaker. So we give liberty to the consumer to be part of the decision-making process. And so you can deny or you can refuse to be admitted, or you can accept to be admitted. So giving you an admission is not mandatory. It is a decision that we are supposed to arrive to between the service provider and the consumer, or the caretakers of the consumer. This is a right. It is a right. Of course, I'll share with you under what circumstances some of these rights then can be dispelled. Now, you also have a right to access to medical records. When someone has given you information, I'm sick, I have a fever, I have this, and you're writing down and you're putting in your computer, etc., they must have a copy of the medical records. The medical records are having information of the patient, and so they are the legal owners of that information. So why do you not give them a copy of their record? Every time you go to the hospital, come back with a medical record. Because I mean, you've given your information, you've given your age, you've given the way you're feeling. So this information must be with you. You must have a copy of it. I've seen healthcare units now, they only prescribe to you and they don't give you the medical records. It is a right to access your medical records. That is a given. Even when you're admitted and they are discharging you, make sure that you ask for your medical records because you may need them in the next referral. So why don't you have them? Ask for them at any time. And also you have a right to be heard and fair resolution. When someone has a complaint, they have a right to be heard. Let them speak out so that they are heard. And it is our right as healthcare providers to actually listen to you as consumers. And lastly, you have a right, the family engagement is a right of the patient. So we have a right to patient and family engagement. Your family members should be able to come and see you. In any case, if they're not able, you should be able to be given an opportunity to speak to them. If you've been hospitalized somewhere and your wife or children are somewhere else, they should give you an opportunity to speak to them. You should be able to engage with your family. Even when the disease is infectious and they have given you some sort of isolation, then the healthcare provider must make sure that you continually engage your family. Because many people heal when they have family support. So how many of us are denied these kind of things because we are in isolation or they have taken you somewhere for treatment and so you don't have access to your people? So the right of a patient to have family engagement is not negotiable. So colleagues, these are the globally acceptable patient safety rights that we have at a global level. Now, every country is supposed to go back, break them down, and then domesticate them to fit their context. Now that you've understood a little bit of a global perspective of the 10 patient rights, we see a call to action by the WHO calling upon member states now to come up with regulations, come up with legislative frameworks, come up with stakeholder engagement where we are able to create awareness and give you this information. And this is part of what we are actually doing, stakeholder engagement. So they even called upon member states to incorporate them into policies, come up with accountability frameworks for these patient rights, communication and advocacy, how do we communicate them to people out there, capacity building of health workers and patient advocates, monitoring them, do research, and then also international collaboration. These are the calls to action that all countries are supposed to undertake to actually domesticate these things. So you see that what we are doing now is part of what is provided globally, and then we are able to bring it down to you. All right, now a number of stakeholders are concerned when it comes to these global rights of patients. We are looking at the patients themselves, their families, their caregivers, the general public, civil society, international organizations, the media, patient organizations, patient groups, patient advocates, health workers. All those are actually affected by the Charter. So the Charter provides for all this. So the Charter is not only for patients, but even the families of patients, the caregivers of patients, the general public. We must know these things. Health workers must know. By the time I'm going to work on a patient, I must know that this patient has rights. They have responsibilities. The policymakers must know this, such that when they're making policies in health, they integrate these aspects. Professional associations talk about the medical board, or maybe the professionals agencies. They must know these things, such that every time they are coming up with anything, the consumer rights for health are actually incorporated, including the human rights experts. Because, I mean, if someone contravenes this, then it's a human rights violation. Even the academicians, we must be able to undertake research in these things. And this charter, surprisingly, when you read it further, you'll see that it was dedicated in memory of the patients who have actually lost their dear lives, or those who have suffered avoidable harm in the healthcare. So it's something very critical that we are discussing this afternoon, and I hope that that preamble should be able now to introduce us to other aspects. Also very important for you to note is that this charter not only looks at the curative healthcare, it actually looks at the entire process of healthcare. It brings on board the promotive, where we are promoting health. So for instance, what I'm doing now is kind of when you look at a patient, before you become a patient, we should be able to prevent ourselves from getting sick. So take an example. If I'm going to the hospital and the regulation is I must make sure I shouldn't use the injectables or those equipments in the hospital without protecting myself, maybe without putting on gloves or without putting on a mask or something like that. Now that is promotive. You're helping the healthcare provider not to fall sick. If you are a patient or a caretaker and you've gone to the hospital and they're telling you, please do not dump this here, or do not maybe walk on these steps because maybe they have just been mopped and so they are slippery. That is a preventive. They are trying to tell you don't fall and so you become a victim of an injury or something of the sort. Now the other, it provides for protective. Protect yourself. Protect yourself from getting sick. If you're a health worker and you're using injectables or the sharps, we call them sharps, make sure that you protect yourself from actually having access to people's blood or maybe body fluids, urine, or whatever. It can even be preventive. It can be curative. It provides for rehabilitative processes. And this charter also provides for palliative care. So in addition to patients, the charter also recognizes the importance of our families, of our caregivers, our health care providers, etc. Now let us look at Uganda. What I was giving is really global, just giving you a picture how it is. And then for us in Uganda, we have actually domesticated. So let us look at the Uganda's adoption of this charter. Now Uganda has come up with what we call the Uganda Patient Rights and Responsibility Charter. I am not sure if many of us have heard about this charter, but I'm honored to share with you that Uganda has a charter. If you go to the website of the Ministry of Health, you can be able to access a copy. I have tried to put its outer cover there for purposes of all of us to be able to see how it looks like. Now, this charter is supposed to be revised periodically, so it can always change, but the content usually never changes. They just add in other concepts. So we have this in place as a country, and it's really not the very first time we've had it. It has been here since 2009, but this is the edition of 2019 that I'm sharing with you. Now, I first brought this on the cover page. I extracted from the foreword by the minister, and the minister said that we shall work together as a team. That is what is inside that document. We shall work together as a team to ensure wide distribution and use of the patient charter, to increase awareness. Now, this is what we are doing right now. So we are trying to work as a team. Consent and our media colleagues, let us work together to ensure that there's a wider distribution and use of the patient charter for purposes of increasing awareness, but also responsiveness, advocacy, such that we can improve the quality of health services in our country. And I think if I met this minister, I should be able to tell her that we have fulfilled what she asked us to do in this charter. And now I'm also calling upon all of you colleagues, move out there, let us create awareness, let us be responsive, let us advocate for the rights of the patients. So this is just basically what I wanted to start with, to tell us that we are not running out of context, but we are sharing from within the document itself and what the minister wanted us to do. Now, what is the Patient Charter for Uganda? What is this? What are we talking about? What is the Patient Rights and Responsibility Charter for Uganda? First of all, it is an official document of the government of Uganda. That is something that we need to take care of. Let us know that this document is an official document of the government of Uganda. But this document explains the rights and responsibilities of the patients and the health providers. So it spells out the rights of the patient, it spells out our responsibilities as patients, but also the health care providers. Now, we first had a charter in 2009. It has just been revised in 2019, of course, to meet the current standards for healthcare services. I know that they can bring a new version, not a new, but a revised version anytime, whenever it comes. We can always share a copy. But you realize that the rights remain right. So what changes is just a few things. And this charter is supposed to empower communities to demand. That's where the word now is. We need to make sure people get to know this, and then they are able to be empowered to demand for quality care from service providers. These service providers can either be private or public. So it doesn't matter. The charter is for both private and public. But also this charter enables the service consumers to participate in the ownership and management of their health. That colleagues, once we know these things, we should be in charge of our health. When we go to the healthcare provider, you know what to do. You're not deceived around. Now let us look at a few definitions that you find in this, which I find helpful for us now. I'll go through them very fast. Now, when they are referring to a patient, they are looking at all of us in need of healthcare services or intervention. As long as a person is in need of healthcare services or intervention, becomes a patient. Now, what are we calling patient rights? Patient rights are your entitlement when you are seeking for these services. So patients' rights are basically our entitlements or entitlements for a client who's receiving health care service. So you become, those become your entitlements. As long as you're seeking health care services, you're eligible to these patient rights. Now, we also have what we call patient responsibilities. Now, every right comes with a responsibility. If you have a right but you're not taking care of your responsibility, then you can be challenged. But patient responsibilities are my roles, our roles as patients. What am I supposed to do in the uptake of these care services? So the roles of a patient in the uptake of care and support during or after receiving a health care delivery, that is your responsibility. It can either be during the time you're receiving or after. If they gave you medicine, for instance, it is your responsibility to swallow the tablets. So that one becomes your role. If you got sick, it is your role to come to the hospital. So those are what we are calling now responsibilities. Now we also have other terms like clients. These are individuals, but also they can be institutions that receive or that are using healthcare services. We can also talk about health service providers. What are we even talking about? Health service providers are those professionals or their support staff that are providing healthcare delivery. So if you go to the hospital, The healthcare provider looks at the health professional, but also their staff. Whether they are support staff or professional staff, they fall into the health service provider. So you'll find gatekeepers, you'll find these guys who are cleaning, you'll find those ones who are washing the bed sheets of whatever. They all fall under health service provider, as long as they are actually participating in providing the healthcare service delivery. Now, we talk about medical information. What are we talking about? These are just documents or documentation with information that refers to patient's health status. All that is medical information. So we're going to find these words when we are discussing this. Of course, when we talk about consent, we are basically talking about permission. Permission to allow a medical procedure, for instance, to be carried out. If someone is to be operated, they must give a consent. They must sign. They must allow. They must permit that, yes, I agree. If the person is not able to agree, their family members should be able to agree. But also we have other provisions where a consent may not be sought. Well, we can also look at that in this chapter. Now, privacy, we are looking at patients or service consumers not being exposed to the external surrounding while receiving care. So if someone is being supported in the hospital, we need to keep their privacy, not to share their images, not to share their information out there. That is privacy. And then confidentiality. You've actually done a diagnosis and you found someone is HIV positive, or someone is having a particular tumor somewhere, or someone has a particular condition. Keeping this information from clients safe is something we're talking about when it comes to confidentiality. So information from clients should be kept without leaking to the public, unless otherwise, but it should be kept safely. Now, we shall also see in this chapter something called public health concern. What is it? When Bernard talks about it's a public health concern, what are we even talking about? We are talking about a health situation which is likely to affect or cause adverse health effects to other members of the community. So we shall see later on that actually where we have a public health concern, some of these things are given some leeway, but we're going to explain how that happens. Lastly, we have something called medical emergency. Now, these are kind of life-threatening situations requiring immediate medical or surgical attention. The reason I'm defining these terms is that we're going to see them, especially where we can bypass the rights. Okay, so let us now look at Okay, when you look at this charter, it has objectives, and the objectives are basically promoting awareness, empowering clients to demand and utilize high-quality healthcare services, but also to enhance clients' or patient capacity to take responsibility of their health and strengthen feedback mechanisms. So those are the objectives of this charter. Now let us explore the patient rights in Uganda. What are these rights in Uganda? Which ones have been domesticated for us? I think it will be very important for us to appreciate within our context, out of this whole thing, what has the ministry prioritized? Now let us dive into them one by one. We have the right to health care. Every person in Uganda who is in need of health care is actually entitled to impartial access to treatment. If you are in Kasese and you find that you're coming from Kasese, you've gone to Hoima, and then you have a healthcare need, you are not just supposed to, you are entitled to impartial access to treatment. So the treatment which is in accordance with regulations, which is in accordance with conditions that you are suffering from, and also arrangements obtaining at any given time in the healthcare system. The word is you are entitled. Secondly, the entitlement is impartial. So it doesn't matter whether you're young, whether you're old, whether you're Mkonzo, whether you're Mnyarwanda, as long as you're in the country and you need health care, you are entitled to it. And by the way, the entitlement can be obtained at any given time in any healthcare system. That is the right that we have as Ugandans. Now, in a medical emergency, I just defined those terms. In a medical emergency, a person is entitled to receiving emergency medical care unconditionally. And this can be in any health facility without having to pay any deposits or fees prior to medical care. Now, this is the provision in that document, that you have a right to health care, but in an emergency, a medical emergency, a person is entitled to receiving emergency medical care, first of all, unconditionally, in any health care facility, but also without having to first pay. We can make payments or deposits or whatever later when the medical emergency has been sustained. That is the right. That is the right. Like, that is it. If you're running to a hospital and you're in a medical emergency, no one should first make you first pay, first deposit money, first do what it is supposed to be an immediate, because it's an emergency, meaning life can go anytime. So this medical care should be unconditionally provided. It must be provided in any health facility, whether private or government, as long as it has the ability to do that. But it must happen without having to pay any deposits or fees prior to the medical care. Now, in emergencies, you need to first receive care. These other deposits and payments and whatnot, they can come at a later time. So think about it in your area. What is happening? We can receive answers in the chat or later on. Now, should a medical facility be unable to provide treatment to the patient, it shall, to the best of its ability, refer this patient to a place where he or she can receive appropriate, timely, and quality medical care. Now, we have seen facilities that hold the patient there and they cannot afford to manage them. The Charter tells us that the right to health care does not need to wait. As long as this health facility cannot manage this case, it must make a referral with immediate effect. But they must refer to a healthcare unit which is either higher than them or that has potential to actually manage these cases. So they will transfer you from Kasese to Mbarara, from Mbarara maybe to Kampala, from Mulago to Kenya, as long as it's a medical facility and is unable to do it, it has to refer to the next level. And that is the provision. Now, we also have a right to prohibition, prohibition of discrimination. Now, no health facility whatsoever or a health provider shall discriminate between patients on the grounds of disease, on grounds of religion, on grounds of tribe, on grounds of clan or political affiliation or disability or race whatsoever. The right of prohibition of discrimination is a given to all patients. And therefore, we do not expect someone to be denied service because they are not of a particular race, because they are of a particular gender, because they have a particular religion or social status or ethnicity or nationality. And that's why if a Ugandan, for instance, got sick in the US must offer him support, medical support. If an American got a challenge in Uganda, we need to first save this life before we can even negotiate other things. So it is a right of no prohibition of discrimination. So it doesn't really matter. A person must be given health care. We also have a right to participate in decision making. You as a patient, you have a right to actually be involved in a decision making. Let me give you an example. If someone goes to the hospital and they want to give you an admission, you have actually a right to refuse to be admitted because of reasons that are best known to you. But you must take your responsibility of the consequences that come with the decision that you've actually taken. There are people who are given medicine, and you know, maybe they've given you a regimen or a medicine that has sulfur, but your body reacts to sulfur. So you can make a decision, you can participate in the decision of refusing to take a sulfur-rich medication, and you opt for another if the alternative exists. And if the alternative does not exist, you have a right to refuse until the alternative comes, or you can even go and buy it elsewhere. So every citizen has the right to participate or to be represented in the development of health policies, for instance, but also in these other system-related legal issues. The same decisions at the hospital. If, for instance, someone has to be operated, you must participate in that decision as a family member. You can actually refuse someone or your neighbor or rather your patient not to be operated. It's a right there. Yeah. We also have a right to a healthy and safe environment. When you're in the hospital setup, it is you have a right to make sure that wherever you are seeking service, you are safe. A healthy and safe environment. Everyone has the right to a healthy and safe environment that will ensure physical, mental, and social well-being. By the way, this also includes access to clean water in the hospital setup. It could be in the hospital, it could be in a pharmacy, it could be in a clinic. You have a right to a healthy and safer environment. You cannot be there and then the hospital is having fumes. You know, they have sprayed the hospital and then everyone is sneezing all over. They are throwing garbage everywhere, you know, and the waste of the hospital is mismanaged, etc. No, everyone has a right to a safer environment, but also an environment that is healthy. Not only physical health, but also mental health, even social well-being. When you're in the hospital, healthy environment would mean where are people sleeping? I have seen people sleep on bare ground in the hospital setting. I have seen people sleeping on beds with bed bugs in the hospital setting. I have seen people sleep on, dilapidated infrastructure in the hospital setting. I have seen people pick water from rusting taps, but in the hospital. Now, this is what we're talking about. Who is fighting for these consumers? Think about when you go to a clinic and then there is this dispenser where there is water because the themselves says you're going to take this medicine now before you leave. But then the dispenser where they are getting water, my friend, it was last washed like 3 years ago, or it has never been washed since it was procured. So think about it from the water supply, from the sanitation, from the waste disposal in this healthcare unit. How is it? Is it protecting the safety of consumers who are seeking services there? Is it providing a healthy environment? All those are supposed to be investigated. Now, you guys of the media, you need to know these things. We also have a right to proper health care. Now, proper health care, what are we talking about? That a patient shall be entitled to appropriate health care with regard to both, one, professionalism, the way people are handling the patient should be in a professional manner, should be handled by qualified health care practitioners. You know, patients must be, sensitive of patient's culture, patient's religion, quality assurance based on clinical needs, the proper health care. Do we have professionals working on these guys? Are we being worked on by qualified healthcare providers? Are the healthcare providers who are working on us actually culturally and religiously sensitive? Are there quality assurance kind of standards in these hospitals? Because we must, no, not we just must, we are entitled to appropriate health care. And I've just told you what that entails. Professionals, qualified healthcare professionals, sensitivity of patients to their culture, traditions, and whatnot, but also quality assurance. Is there someone doing quality assurance in these healthcare units to ensure that we have proper healthcare given to the patients? We are also entitled to every patient has the right to be attended to by an identified service provider. What does this mean? That every time you go to the hospital, be keen to take note of the following. The person who's working on you, you must be able to trace their name and their cadre, what we call their cadre. So for instance, Tanya, occupational therapist, Bernard, nutritionist. It is mandatory that when we are in the healthcare system, we must put on some sort of a visibility item that the patient should be able to tell that this is a nurse, this is a midwife, this is a doctor, this is a clinician, this is an occupational therapist, this is a nutritionist, this is a dental surgeon, etc. So every patient has that right to be attended to by an identified service provider. And in fact, you must know their name and you must know their cadre. Now, I don't know when you guys go to the healthcare providers whether you're interested in this, but this is your right. You should be able to identify who's working on you. And in fact, from practice, because where I've trained, it is mandatory when we are training these things that we are told, don't go to the hospital without your lab coat. Your lab coat must have your name. Many of you have seen me with my lab coat. It has my name. It has my cadre. This is it. And this is what it should be. So don't be worked on by someone whose cadre you don't know. Someone needs a doctor but is being worked on by a midwife because you mix them. In our communities, people think anyone in white is a doctor. They are clinicians, they are physicians, they are nutritionists, So let us know who is working on us because that is what it is supposed to be. We are entitled to know them, even know their name. Okay? We are also entitled to, we have a right to safety and security. Of course, the patient has the right to safety and security to the extent that actually the practices and medical equipment in health facilities do not harm us. Think about it, people have had HIV acquired from healthcare units because a nurse used the sharp which was used on an HIV patient and now they are using it on another patient. So there you're compromising the right to safety of this person, And then of course security, we must be secure. The right to safety should also apply to patients' physical, sexual, and mental safety. Making sure that our hospitals, our healthcare units do not lead us into sexual harassment, mental safety issues, etc. So all of us are entitled to safety and security when we go to the hospitals or whenever we go and seek healthcare. Now, you have a right to receiving visitors. This looks a little bit crazy, but yes. You have a right to receive visitors when you're sick. Now, in a situation where you've been admitted in a hospital, a patient is entitled, first of all, you can request that you want to see your people. And the healthcare provider must make sure that you receive the people that you have requested for. So for instance, you've had people say, I want to see my mom. We must help this person to get to their mom. Maybe you bring the mom in there, or their dad, or their relative, or something. It is a right to receive visitors. It is not a harm. Now, you can be entitled either to request or to receive them, but also you have a right to refuse the visitors. Now, in any case, if someone comes to see you, you have a right to refuse and you say, I don't want to see that person in my room. I don't want to see that person. And they will take that person away because it is your right. You have a right to receiving visitors, but you have also a right to refuse the visitors. And by the way, you can refuse them because of reasons best known to you. And for us, we don't need to know why you are refusing them. It is you, the patient. So you can refuse them because maybe it is your ex, you don't want to see them, you separated badly, or maybe it is your enemy or whatever. You can refuse them. You have a right to refuse. And when you refuse, we don't negotiate with you. that now you see, the patient has said. Yeah. We also have a right to informed consent. Every patient has the right to be given adequate and accurate information about the nature of their illness, about their diagnostic procedure, about the proposed treatment, such that it helps them to make a decision. Now, this informed consent should just say, okay, sign here. No, first provide the information. We are supposed to be given accurate information. Someone tells you, you know what? The lab results indicate that you have A, B, C, D, and E, and it is likely to affect you this way, and we propose to take you to the theater to be able to cut it off or to do an operation. Now, when the patient receives all this information, they can then make an informed consent. They can agree on the surgery, or they can have an opportunity to ask for alternatives. If you're not giving me a surgical procedure, what else can you provide? Can you maybe give me treatment for a couple of months or something related to that? So the information shall then be communicated to the patient at the earliest possible stage. Not this business of telling the person when they have 2 minutes or 1 hour to the theater. You must provide this information in advance, such that the person prepares their brain, their mind, their everything to make sure that they give you feedback and consent willingly. Now, let us kindly note the following. There are some times when the clinician or the healthcare provider may withhold the medical information from the patient concerning their condition. But this should be if he or she strongly feels that by giving this information is likely to cause severe harm to the patient. Now, that's why hospitals are supposed to recruit, for instance, people we call the counselors or psychologists. In any case, if we see that the information we are going to deliver to this patient may be harmful to them instead, then we can be supported by those colleagues in the counseling, or maybe those ones, the ones in those in the psychology, to help us first retrieve this information and find a way of packaging it. So that is the only circumstance under which the information should not be provided to the person. But in a situation where there is no need of keeping this information to ourselves, we must actually tell the person, and then the person makes decisions and makes an informed consent. Now, there are ways in which informed consent may be given. In the hospital setup, informed consent may be given either verbally or in writing, or it can even be demonstrated by patient's conduct. The patient can take a way of, different forms of consenting. Either they can verbally say, well, I consent or I refuse, or they can write it, or even the way they are behaving can show you that they don't actually want. So here we bring in the non-verbal communication cues. I've seen patients who run away instead. I have also seen those ones. That means they are just not agreeing with what you want to do. You schedule them for something and they refuse to come. So that is patient conduct. Consent should be witnessed. Now, in a medical emergency, someone has been knocked and then they have been rushed to the hospital, and then we need to open up the heart. We need to maybe open up the brain and do some bit of brain scanning and whatever. In such a medical emergency, when in the opinion of the medical practitioner, he or she feels the requirement of informed consent can be waived, we can also waive some of this consent, especially in the medical emergencies. However, consent should be sought from the patient or next of kin as soon as the circumstances permit. Some people have been taken to theater just very quickly because they had a traumatizing accident, they couldn't survive, and so we drop them in an emergency unit and we start working on them before we even take any records or whatever. But as soon as we are able, we take that information or we seek consent. But at least when we've saved life. Now, this only happens in medical emergencies. Now, the patient should give his or her informed consent if the institution is proposing to carry out or undertake human experimentation. There are people who are sick, but given their condition, we want to study from it. It is a rare condition and we want to study from that condition. Those patients must give consent for us to be able to use their blood samples, their stool, their sweat, their urine, or even using their biopsy, those small pieces we cut from your organs for experimentation or whatever. We must know. Even when you're experimenting a medicine or treatment on somebody, they must consent. They must consent. And of course, the patient has the right to decline to participate in any of those stages. They can agree to start the study, but they may refuse and they decline during the course of the study. So that is the different ways in which consent may be given. Now, we also have situations for medical care without consent. We can also do some work without necessarily consenting, but they are circumstantial. For instance, a healthcare provider may give medical treatment without informed consent if the patient's physical or mental state does not permit obtaining his or her informed consent. Someone does not speak, someone cannot write, someone is in a mental state that is, or someone is physically impaired. Like we have seen those cases where someone is physically impaired and we need to quickly do a medical examination and a theater-related activity. In such a case, we do a medical care without consent, but as soon as at the earliest time possible, we should be able to document the consent. But these are the scenarios. But also second scenario, if it is impossible to obtain consent of patient's representative or the guardian, when the patient is maybe a minor, think about a baby. The baby has been found on the street and the caregiver has come and dumped them in the hospital. The baby cannot speak. We can't do much, but we need to operate on them. Now, being a minor, maybe a child of 4, 10 years or whatever, we have no options and we have no access to their guardian, we have no access to a representative, but we must do something. So we can always proceed with those. And those are the only situations that we can do medical care without consent. If the patient has an illness which is a public health concern, sometimes they don't need to seek your consent. They just need to quickly isolate you and quickly give you medical support as long as your condition is a public health concern, meaning that it can spread to other people as immediately as possible and cause harm to others. Now, there are also situations where the court demands. Maybe you have been having legal issues and the court demands that we provide some tests. Maybe in situations of poisoning, someone has been poisoned and the court rules that we need an examination from the healthcare. Now, medical practitioners can use the court order to actually do an assessment. But we are kind enough to still even seek for consent. But in a situation you refuse to give consent and the court has ordered, sometimes they can do without consent. Now, these are the only 4 provisions that the Charter provides for. You also have a right to refuse treatment. It looks weird, but that is it. You can refuse treatment. So refusal of treatment may occur, of course, under some circumstances. So a person has the right to refuse treatment after receiving information to make an informed decision. Such refusal shall be verbal, in writing, or by the way the person conducts themselves, provided that such refusal does not endanger the health of others. If this refusal of treatment is only affecting you and is not going to affect others, we can actually agree with your refuse of medicine. We've seen people who refuse, HIV patients or whichever, they refuse treatment, and we have no option to force them to take the treatment, because if they die, it is them who are dying, no one else. So as long as you are refusing this medicine, we can only agree with your refusal if your disease or if your refusal of medicine or treatment does not endanger other people, your family, and etc. If it only endangers you, we have no options. We can always take on your refusal and we don't give you the medicine. You can even go to the hospital and they tell you, now malaria is negative, but you see, let us give you anti-malarials. Please, if you feel like they have told you there's no malaria, you can refuse that. No, it's just I don't have malaria, I am not taking on that. That is your right, it is there. So that is refusal of treatment. Sometimes they say, want to operate you, say, no, give me medicines instead of, this. Sometimes they want to give you an injection, and you say, no, I don't want the injection, I want a tablet. As long as that refusal is not endangering any other person, we shall adhere with it. So, when the refusal of treatment by the patient or his authorized representative interferes with the provision of adequate treatment according to the standards, now the service provider must terminate that engagement with that person. So whenever we see that you have refused treatment and that is what was supposed to be done and you've refused it, we terminate your relationship with the service provider. And so you go and struggle on your own as long as you refuse and whatever. But also the health provider has the right to perform the treatment against the patient's will. Sometimes the health provider may perform this treatment against the patient's will, especially under these conditions. If the patient has an illness that is of public health concern, they can treat you without your consent as long as they feel that this disease is going to spread right away from you to other people. Think about Ebola. If the person refuses treatment for Ebola but they are positive for Ebola, the service provider will continue to treat you without your consent to treat, because they know that this is a public health concern and is going to affect other people. Now also, if the health provider realizes that you are refusing treatment, but this treatment is meant to protect the unborn child or a minor or a disadvantaged person, they may proceed to actually offer you that treatment. As long as they see, if they don't offer this treatment, then the baby, the fetus is going to die. Now they can just decide to give you that treatment as long as they're protecting the unborn or they're protecting a minor or a disadvantaged person, or maybe when the court order comes, or if there's a court order, your refusal of treatment may not work. So also those are the only provisions that we have in the charter. Under what circumstances a refusal of treatment may be null and void to the health professional. We also have a right to be referred for a second opinion. Colleagues, you know very well that there's a lot of misdiagnosis. You go to the hospital, they tell you you have this disease. Before you quickly agree, you have a right to go to another person, another health provider, to really seek a second opinion. We've seen people diagnosed with cancer, but actually when they have benign tumors. We've seen people being diagnosed with cervical cancer, maybe ovarian cancer, whatever. But when they travel to other hospitals, they tell them, no, you don't have anything like a cancer. So you have a right to be referred for a second opinion. When someone gives you a diagnosis of these heart diseases, it is very important nowadays that a consumer can seek a second opinion from another healthcare unit, such that you are really, you're being managed for a real thing. We've seen people come in Uganda, they tell you have a cancer. You fly to Nairobi, Aga Khan, they tell you there is nothing like a cancer in your life. That is where this right comes in. A person has a right to seek a second opinion about their health. So every one of us has the right to be referred for or seek an alternative opinion with or without request, whenever indicated. So it is your right. Don't be there and you say now, you see, doctor has said, if you're not sure, seek a second opinion. Yeah. And then also we have a right to continuity of care. Someone has been diagnosed with a particular disease and they're supposed to be on life treatment. They have a right to continue receiving that treatment until. So no patient shall be abandoned by a healthcare provider or a health facility that initially took responsibility for one's health, unless a patient chooses otherwise. If I come to a hospital and I'm admitted, I must leave the hospital when I'm fit to leave. I am not supposed to be denied in the middle there that, you see, you may not manage to afford this bill. Please leave. No, I have a right to continuity of care until I decide to leave. or until I am declared fit to live. So no patient should be abandoned whatsoever by a healthcare provider or a health facility that initially took responsibility for one's health, unless the patient chooses otherwise. So as long as you've admitted me and I am there, you have to look after me until I cure or until I'm fit to live. So you cannot now start despising me in the middle there, that now because this guy has a Lugezi, he has been asking many questions, now you terminate my care. Continuity of care is a patient's right. Yeah. You have, of course, a right to confidentiality. This one, we can't speak so much about it. We've talked about it over and over. Of course, issues of privacy. When you find that I have my boil somewhere, it has to be confidential. You have to keep my information concerning my health, including, by the way, information regarding treatment, may not be disclosed with informed consent, except when required by law or court order. Now, the facility management shall make arrangements to ensure that the health provider, that the service provider shall not disclose any patient matters brought to their knowledge in the course of health care. A health facility or a health care worker may, however, pass on medical information to a third party in only 3 situations. Situation number 1 is that the disclosure is for purposes of patient treatment by another healthcare worker. So for instance, if you come to the hospital and we take off information and we get to know what is happening, and then I'm going home and another colleague is coming on the ward, I'm handing over, I am supposed to notify them about your information, but this must be for purposes of treatment. So I can tell them that, well, this patient has this particular problem, and that is what we do. As long as the disclosure is for the purpose of the patient's treatment by another health worker, that is when your information can be given out. Maybe the other example would be that you can have a referral from, say, Amodat, and maybe you're coming to Moroto Regional Referral. So we need to provide and disclose some of this information to the person we are referring you to. That is the only condition there. Condition number 2 is that we can disclose your information if we need to protect the health of other people. So if, for instance, someone that has Ebola or COVID and we are transferring them from one location to another, we can disclose this information to the next person who is going to receive you, or maybe to the ambulance driver, so that they take precaution. You know, those are the only conditions that we have. The third condition is that the disclosure is for the purpose of publication in a medical journal. We also have provisions. If, for instance, we are putting this in a medical journal, but the condition is that the personal data is anonymized. So that is when we can disclose for purposes of public publication in a medical journal for research. We can get your samples like we've always done, and then we analyze malaria. Okay, this number of malaria, this number of this, it was common in children, it was common in adults, blah, blah. And then we don't mention your names, your age, whatever. It is for purposes of publication, and so you will not see anyone's name, but they will be anonymized. So those are the only 3 conditions under which confidentiality can be, I don't say breached, because I mean, those are the only 3 conditions that we don't keep the confidentiality. And of course, you see that in all cases, there are provisions that work in there. So as we come to the end, the patients also have a right to medical information. This one, I started with it. You have a right to medical information. The patient shall be entitled to obtain from health service provider or medical facility or health information concerning himself. And mind you, I told you already that you must have a copy of the medical record for yourself, your medical record. You have to go with it. It is your entitlement. You must have access to a copy of your medical records. The patient shall be the legal owner of that information, not the healthcare unit. It is you, it is your information. So it is you who is the legal owner of that personal medical record, and the health facility is just a custodian. Now, kindly take note of this. I know that many of us might not have known some of these provisions. If I get sick and I go to the hospital, if I have a general health condition, the hospital must keep my data for 25 years after the data or after the date the file was created. Say, if a child or if a person goes to the health center today, 2026, and they give this hospital their data, this hospital is supposed to keep your data for 25 years from the time they have taken the data. And that is what the charter says, 25 years. And if a person dies, they should keep your data for at least 3 years after your death or after my death. So you see that the charter provides that someone can be born today, so you don't need to throw away their data. You keep it because at one point they may need their birth certificate. So they must come back to that facility and you must provide this data because you have it. Or 3 years after the burial of somebody, that's when you should throw away their data, because the family can come back and they want a burial certificate, rather a death certificate, and you have to use the information therein. And also maybe because your record has my post-mortem data, so you must be able to provide that data to the family members or whatsoever, or court or whatever, at least 3 years after death of the individual. Now, if it is obstetrics, like people who maternity deliveries, those things, also 25 years after the birth of the child, the mother has been coming for antenatal, they came to deliver from your healthcare unit, whatever, you must keep their data for 25 years after the birth of the child. But also, it includes stillbirth. Stillbirth is when you deliver a child and the child is dead on arrival, or the child is dead at the time of, you're delivering a dead child. That information must be kept for 25 years in that hospital. So I don't know how your hospitals are doing it, but that is the charter, and that is it. If it is a psychiatric issue, some people who are mad, mentally disturbed, or whatever, for their data, it must be kept for the lifetime of that patient. PACA lasts, it's not even 25 years or 30. That information must be availed throughout the lifetime of the person and can be discarded maybe 3 years after their death. So those are the provisions that we have for in the charter for rights to medical information. Now, at the conclusion of course, periods set above, the records then may be destroyed, but there's no obligation. Of course, there's no obligation to do so, that you must destroy them. You can even keep them beyond. Of course, for research purposes, clinicians may always ask for indefinite retention. They can want you to keep all those records for as long as people live. Yeah. So that is that. We have a right to feedback. I think this is also very important. So every health facility shall establish, the word is shall, every facility shall establish a mechanism for patient feedback and designate a person or a committee to be responsible for observance of patient rights. Now go back to our facilities.
Okay.
Yes, sir. Okay. So every health facility shall... Henry, are you saying something?
We kind of lost you.
Oh, sorry. Are you able to hear me? Okay. All right. So every facility shall establish a mechanism of how they have to collect feedback from us. And also, not just creating a mechanism, they should even have a person who is responsible for gathering feedback. If he's not a person, they can even come up with a committee that is responsible for observing patient rights. And the charter even goes ahead to provide the roles and responsibilities of that designated person or that designated committee. So think about it. If you're in Fort Portal, are those hospitals and healthcare providers actually having a designated person whose role is to keep feedback, collect feedback? Do they have committees on feedback? Think about if any hospital you are in or any healthcare provider must have this. This is what the charter says. The roles of this person should be to give advice and assistance to a patient such that they realize their rights. They should receive, they should investigate, they should process patient complaints. They should educate, they should instruct all medical personnel, even administrative staff in those hospitals, in all matters regarding the patient's rights. And then there should be a mechanism of feedback which should be established in that hospital. So every hospital must have these people who are supposed to advise people on their rights, who must receive, investigate, process patient complaints, but also who should be responsible for educating the medical personnel, administrative staff on these matters. And it is mandatory that every healthcare provider must have a mechanism for feedback. It must be there. So, colleagues, these are some of the things that you can start with when it comes to your areas where you're coming from. Do we have these things in place? We also have a right of discharge or a right to receive dead bodies. Now, the patient shall have the right to shorten the length of their stay. For instance, if they have admitted you for 3 weeks, you have a right to say, well, I want to be discharged. It is your right. Like, the doctor is not giving, for them, they will admit you as long as they can manage you or as long as you're sure. But you have a right to be discharged. You have a right to even ask to be discharged. So the patient shall have the right to shorten their length of their stay in the hospital. It is not mandatory that when they tell me I will spend there 3 weeks, then I should be there for 3 weeks. No, you can shorten the length of your stay. It is your right because you have probably a family or something, and you have a right to do that as long as the discharge you're asking for is not compromising others. So the patient shall have the right to be discharged, or the caretakers to take the dead body, and may not be detained at the health facility because of procedural reasons or pay disputes. In fact, the person is not supposed to be held in the hospital because of disputes relating to payments or these procedural issues. Now the director is not yet here, he's supposed to sign this, now this one is not here, this one is not. No, the patient shall have the right to be discharged, or the caretakers to take their dead body. Someone who has died, you have a right to go and pick your person, your cadaver, and should not be detained at the health facility because of procedure. Oh, now we need first go to the mortuary. Now we need first wait for someone to come. Now the other one will come on Friday. Now before he comes, we cannot do what? Those things should not delay people's discharge. So that is what the charter tells us. But of course, we don't know the things, and therefore we need to make sure that everybody out there comes to know these things, We have a right to choose medicine and care. That the patient shall have the right to choose where they actually purchase medicine and also where they seek care. Not necessarily in the health facility where they are being treated. That is what the charter says. So when you are being treated in a particular hospital, it is also not mandatory that all medicines must be procured from there. You have a right to choose where to buy your medicine as long as they are credible. You have a right to even seek, to choose where to seek care, as long as you know what to do. You can only be advised, but you can choose. For instance, you've gotten a disease, you've gone to Mulago, and they have told you are sick of ABCD. Now, you are coming from maybe Ibanda. You can decide that instead of being admitted in Mulago, for you want to be admitted in Ibanda. Then you travel and be admitted there. It is your right. You have to choose where to seek health care because of reasons best known to you. Maybe it is closer to your home, it is closer to your benefactors, it is closer to your caretakers. So you choose where to buy the medicine, where to seek health care. It is up to you, Then also you have a right to transparency in charges, especially when it comes to the rates of money we are paying. The patient shall have the right to know the charged fees. And these fees for the medicines and medical care are supposed to be received on an itemized bill. They are supposed to give you a bill, but this bill must be itemized. So they say Panadol 5,000, Coatemu 10,000, the drip 3 drips 20,000, consultation fees 50. So the bill must be itemized. So not this business of, oh, your bill is 100,000. Where does it come from? So you have a right to even ask, break it down. So they break down. They say theater. You'll realize that sometimes patients pay a lot of money for services they have not used. They give you a bill and has a theater, but you have never been to theater. There is a bill for blood transfusion, but you didn't have a blood transfusion. But because they have put the bill together, or they have given even itemized, but they have not read it, you see trouble. Therefore, ladies and gentlemen, your bill must be itemized, meaning that everything written on it must be costed, and you must be able to read it. So that is that. Now, lastly, we have, of course, responsibilities. Those are rights. Those are the rights. But as consumers, we also have responsibilities. These ones are not really on them. Now, these are what are you supposed to do? Now that you have the other rights, you also have responsibilities, my people. First of all, you must provide the information. Every patient has the responsibility to provide the health providers with relevant, complete, and accurate information. Some of you come to the hospital and you say you have pain, but actually when you have an ache, so your skin is aching, but for you say the skin is paining, It is your responsibility. When you tell me that your skin is paining, instead of telling me that your skin is itching, I am going to give you medicine for itching instead of giving you medicine for pain. So it is your responsibility, colleagues, to provide information that is accurate, relevant, and also complete to this person. Which I'll ask you for your age, your gender, your whatever. If you provide us a different age, then you're going to give you medicine according to that age, not according to the age that you have. You get it? So that is where the trouble actually lies. 2, compliance with service provider instructions. The patient has the responsibility to comply and adhere to the prescribed treatment. When the guys give you treatment and you've agreed with it, it is your responsibility to comply. If they tell you, take 2 tablets, please take 2. Now that is your responsibility. Even when you have the right, but you have to make sure that you comply. If they have told you, this medicine, take it in the evening, for you don't take it in the morning. That is now up to you. Now you also have a responsibility of own consequences of refusal of healthcare services. When you refuse, because it is your right to refuse, but you are liable to your own consequences. So the patient takes responsibility of of their actions if they refused to receive healthcare services. So that is now no longer us, the healthcare. It is you to take the consequences. You also have a responsibility to respect and consideration. If you have been admitted, respect other people who are within your vicinity, in your healthcare. Don't start spitting everywhere. Don't start making noise for other patients. Don't start now, So the patient has that responsibility to respect the rights of other patients, but also respect the rights of the health providers. Please adhere to the facility regulation. If the regulation says this room can only accommodate 3 people, now don't bring 7 or 10. If they say, please don't spit here, don't spit there. If they tell you, please don't burn Kavera here, don't. Those are the regulations of the facility. So that is your responsibility. Respect others and be considerate. Patients should refrain from using verbal abuse or physical violence against health providers. Sometimes you see patients also fighting the healthcare providers. Sometimes, I don't know for what reasons. But anyway, the issue is respect. Also, pay respect the rights and property of others. You also have a responsibility of possessing a will. Because you can die, it is important that it is up to you to have a will. Now this will is not like my house should be given to other children, this child, it's not what you're talking about. But here we are saying, feel free to advise the healthcare provider. For instance, if you see you're in heavy pain, who soothes your pain? Maybe you have a reverend, maybe maybe you have a religious leader, maybe you can ask. So you can possess a will that I would love to see my pastor. I would love to see my imam. I would love to see a reverend father. That is your responsibility. The healthcare provider will not tell that maybe you want it. It's up to you to seek for these. So you can possess a will and you say, guys, before I die, or if I die, I would want this to happen. Don't put me in the mortuary. Do this. I don't want to die when there is. So those wishes, make them. And then also you have a responsibility of staying healthy and safe. Please don't go to the healthcare unit and then you start going to wrong places. Make sure that you stay in a safer place. That is your responsibility. Now, contravention of this, people can be penalized. So there are penalties in this charter. Any health service provider who contravenes the rights may face appropriate disciplinary action from the responsible persons or body. So we talk about maybe health unit management committees, from the Health Professionals Council, from medical bill boards, and also court of law. So whenever we contravene, there's always a risk that these penalties are spelled out in that charter. I think now this brings us towards the end. We have something to do with complying to the required duration of admission. Now, the service providers who are giving us these healthcare services are not supposed to keep us for more than 8 weeks after admission. So the service provider shall determine, of course, each patient's length of stay at the health facility, depending on their health condition as assessed. However, no inpatient, meaning that the patients who have been admitted, no inpatient shall be allowed to remain in the health facility longer than 8 weeks after the admission, unless there are those unless things that come in, unless determined, one, by the responsible health service provider or the facility management. So we always make sure that the patient does not really stay longer in the hospital, because the longer you stay, the more you are likely to get hospital-acquired infections. So we make sure that within 8 weeks, most of these diseases have actually subsided. And so you need to be discharged to go back home. And also we can tell you come every 2 weeks. So that is where this thing comes in. So no patient shall be allowed to remain in the health facility longer than 8 weeks. In terms of feedback, I think this is our last bit of it. In order to provide services that meet health service providers, we need to provide feedback. So all health facilities should have at least one of the following avenues of communication accessible to all clients. One, all these facilities must have either suggestion boxes or toll-free lines or internet-based services, or maybe an emailing address. They should have a WhatsApp or Facebook, etc. These are the provisions that we have for feedback. Every healthcare provider must have at least one of them, and that is what the whatever tells us about. At least let them have a suggestion box. So go back to your facilities. Do you have a suggestion box? If not, do you have a toll-free line? If not, do you have internet-based services? Maybe you can send us something on the internet or something. Do you have an email where we can write our complaints? Do you have a WhatsApp where we can reach out to the facility? Do you have a Facebook account maybe where we can complain? At least there should be something. Every healthcare unit must have this. And B, a feedback focal person. Those facilities where we are near, where you stay, do they have focal persons? But they must be available at all these units, and that's what the charter says. Anyone not satisfied by the responses given may refer the issue to the next level of responsibility, and where need arises can inform in confidence the in charge. At the ministry, they also have a feedback line, which I have tried to put there. You can call on that one. They have a PO box number, you can write for them, etc. And these are the feedback numbers for the ministry. They can always be called. Of course, toll-free center, they have a website, they have an email, they have a physical location where you can go, and then they have the social media handles in which you can submit your complaint. So ladies and gentlemen, allow me to end at that. Sorry for taking quite long, but I think it was inevitable that we needed to understand the rights and responsibilities of patients, such that you can be able to communicate them wherever you are. And apologies once again for taking long, but I hope it was helpful to all of us. Thank you, colleagues, and allow me to stop at this and hand over to Henry. I know that our time also is fast spent, but yeah, thank you. Thank you, colleagues.
Thank you very, very much, Bernard. You don't know how you always make me proud when you get complex issues you simplify them, you ground them, and then you serve them. I always refer to your presentations as a mixed nutritious grill, or a mixed grill that is nutritious, giving us all the healthy foods or minerals, vitamins, and so forth that we need to grow and stay healthy. What you have just shared with us, if I would do a poll, I trust everybody has been touched, has got examples, has been a victim, or has been irresponsible, because you have shared with us our patients' rights. You have simplified them from a global perspective to the national perspective. And as you were sharing them, giving us live examples to which I was walking my memory lane and linking them. Then you brought in what most of us will look at as a big weight, the consumer responsibility, the patient's responsibilities. Having had tons and tons of rights, then you brought in the responsibilities, simplifying them down to the Mutwawansi, the last person on at the end of the mile of society. So, ladies and gentlemen, what a rich exposure we have received from our college, and I trust each one of you, if given an opportunity, you have got a million stories because you have already shared them. If I give Ronette an opportunity, she could give you the dashboard of the responses that you gave while you were registering. And when you look at them as we'll be making our report, they become an advocacy and an element for which you can use to speak out and share and build the capacity of consumers to demand for quality services delivery, and also to take responsibility where it is needed for having responsible consumers taking action correctively. So when you look at all this, it is all about empowering you to be in position to represent, because as the fourth estate, you are the eyes, the ears, the voices of society. That said, Ronette, if I could give you a minute or two, you could say a word or two to the dashboard that you have shared and what you generated so that our colleagues get to know. Ronette, the floor is yours. Ronette, I'm sorry for ambushing you.
The dashboard is already up and running there, but she has requested me to speak to it. Her microphone is not well. So, colleagues, this is information that you provided us this morning when you are registering. But you see that if you look at the question number 1, whether you are aware of the Uganda's Patients Charter, you realize that many of us, they knew the charter, but you know a little bit about it. And I hope now we have known more about it. I hope that makes sense. But also a few, well, they know it, but they are fully aware. Only a few of us were fully aware. And when you look at whether we believe, do you believe healthcare consumers have effective channels to complain? The majority of us are saying that yes, but they are not effective. The mechanisms are there, but they are not effective. And I think that's what majority of us are reporting. Of course, we see also how would you rate the current level of consumer justice and protection. I can see that about 45% of us Say, well, it is fair. It is fair. But you can see that a few of us are saying, well, very poor. Some of us are saying, well, it's good, and others are thinking it is poor. So basically, this is what we make of your of the data that you provide us, just to give us a little bit a quick insight of how and which areas we can emphasize when you're making these presentations. So thank you, colleagues, for participating. Of course, different themes were able to pick different points from you, and just like I've seen in the chat, it's really heavy there. On our theme 1, whether you have extortion and informal payment demands, we see that actually doctors cannot work on some of us without first paying extortion for treatment. Some patients are being extorted actually a lot of money for even government facilities. When you look at the confidentiality bit and private breaches, people are saying that a healthcare worker discussed a patient's condition where other people are. And we see revealing details of one's health condition. We see medical records being accessed by even without patient's notice. We see that treatment started before the procedure was actually explained, so we see that what I've been speaking about, colleagues, you really provided a wealth of information with us. These are your experiences, and these are experiences of the people. We've seen disrespect somewhere, health workers abusing us, insulting and humiliating patients, nurses in Germany shouting at patients. We've seen pregnant mothers being abused. We've seen rude and disrespectful language being reported by you here. We can see alleged tribalism causing delays and even some loss of life. We've seen a woman turning away from cervical cancer screening because she wasn't a sex worker. We've seen discrimination based on financial status, etc. So all this data helps us to, get your ideas, but also frame these presentations in such a way that they are beneficial to us and also the community that you're actually serving. So I want really to appreciate you for sharing with us this feedback from whatever you've shared with us and also in the chat. It's very, very interesting to see that the topic was interesting to you, colleagues, and that many of you are associating with it. I'm also happy to note that probably many of you will then send it out there. I've been able to take time to read through your chats. Very interesting stuff and realities of life. Thank you so much, colleagues. And of course, my part is done. It is now we're in the hands of Mr. Chimera. Sorry for stealing part of your time, sir.
That was okay. If it is the act of stealing, it is worthwhile. That is called beneficial stealing. That is benefiting the Media League colleagues or the Media League family, and it is beneficial for those that are online and they are picking up and learning from all this. Colleagues, the live stream was put in your respective socials, WhatsApp channels. Please pick it up, use it, inform the global world, in particular the 45 million Ugandans, or 45 plus million Ugandans, so that they get to know their rights as patients and also knowing their responsibilities. Our mission with you, the Media League family, is to sensitize, empower, make consumers aware so that they are in position to speak up, to speak out, improve service delivery where you are supporting them by questioning, advising, starting discussions on your media platforms, both electronic and print. So use this information. If you knew about the patient's rights and now you didn't know the detail, now that you have the detail in its simplified form, Can you speak to the local governments? Can you speak to the national level? When you go to cover parliament, when you are at the media center, when you are at functions, when you are at national events, may you please raise these issues, the issues that you have raised. When you meet the service providers, can you raise the consumer voice? Can you write about these issues? Can you bring the voices to the center stage? You are the nucleus who have got the capacity to have ripple effects to better society. So I would like to thank you. I don't know if there is any hot question, any hot comment, because I would request that we use the next 10 minutes as people finish registering, and we will be closing at 20 past. Is there anybody? I'm seeing some are asking, where is the link? The link is in the chart. Go into the chart. It was sent to you at around about 3:50. So the link has just been posted again. Look out for Pauline Josephine Nabala. She has just posted the link. So go to the chat and pick up the link and register. I'm not anybody who has a hand for a quick one. Please, Mr. Dennis Bongole, please unmute. Go ahead and unmute and take the floor. Mr. Bongole, the floor is yours.
Yes, good afternoon, good evening.
Good evening to you.
My question is, where does this charter, or we can call it a law, where does it draw a line when it comes to taking someone's life? For example, if I want to take my own life, does the charter give me that right to do so? That's my question.
Bernard, may you please come in there? It is an interesting question.
Bongole, we cannot start promoting suicide. So the charter provides you the rights. It also gives you the responsibilities. So you must use your rights, but while you are cognizant of your responsibilities. So the charter does not really bring the suicidal mission in the charter. We don't have that. So if you want to die, it is your own thing. Yeah.
In many countries, or sorry, not in many, in some countries, there are provisions where consumers or patients who are terminally ill have got the opportunity. But that is another legislative arrangement in respective countries where a consumer wishes to take their lives due to medical or illnesses. So please, in Uganda, they are not yet there. So thank you. Then can we have King Solomon, please unmute?
Yes, thank you so much, Mr. Shimera. Mine is a question again. In Uganda, do we have a provision whereby maybe, like you said, some countries have a provision of someone who can go and ask for their life to be taken? But mine is more of like, do we have any option where like maybe someone who has a terminal disease could opt for maybe like a do not resuscitate in case their life is out. Like maybe this person dies in an ER or somewhere in the hospital, but they can have an option of not being restored back. Thank you.
Bernard?
Okay, so there are quite a number of other provisions that may not be basically in the patient charter, but we can always find them in other medical legislations that we have. I have not yet come across the. Of course, I know that these things happen, but then I don't know which legislation exactly I can cite. But I think I can be able to pick it and then share with you, colleagues. For now, I don't know what exactly that provision is, but when I get it, I can always share with you. I am not really sure of that provision for now.
Ismail, and then thereafter, Basaja. Ismail, please. And unmute.
Good evening.
Good evening.
Hope I can be heard. I'm Ismail Kabirizi. I am based in Chibuku district, and I work for Daily Express. Equally, I have my own YouTube channel that's called Real Time Post and other social media handles. Thank you for the deliberations. I want to thank you for that. My concern here is when our colleague was deliberating, gave the Ministry of Health contacts. My concern is on this matter that in most cases, when these numbers are maybe tried, someone contacts or make a contact to maybe to call these numbers. Why can't the ministry also design a way that beyond going through a website, go through emails, through these numbers? Because when you look at the number there, is it Uganda Telecom? You get it, it is very hard for someone to call onto those numbers and they go through. Me, I would suggest let there be another formal way. Maybe if there's a WhatsApp contact, at least if someone wants to make a report, can quickly access these people. That's my concern. Thank you.
Okay, thank you. That will be shared. I will be generating aspects out of these discussions and then share them with the respective ministries, departments, and agencies. Thank you for that. Edie, you had your hand up. Are you still interested, or you had put your hand up on behalf of Ismail? And Ismail, congratulations on having your social platform. I know many of you have got these social platforms. What I could encourage I think in our next Media League, could you please share with us your social, the links to your social platforms, and also you can also link up with our social channels. So that could be an easy way to do an accelerator of all that we do. Please feel well to share with us. You can drop them in the chat. Those of you who are still online, in case you have got any social channels where you share issues that you learn from here, or any other issues that are linked to the Media League, drop them in. Or also you can share them through your coordinators in your respective regions. So, Edie, please unmute and contribute. We are remaining with 2 minutes. Please go ahead, Edie.
Allowing participants. Okay, thank you so much. Mr. Bernard, thank you so much for quite an elaborative engagement. Bernard, I don't know if I was late. I wanted to hear from you the legal provisions in an incident where I myself, or maybe a patient, has the rights actually infringed on, like you well explained. what in terms of the legal provisions, where do we run to? What happens when I am a patient or there is a patient whose rights have been infringed on? I looked at a case where we're talking about patient safety rights, and I can imagine rights to patient and family engagements. And here we are dealing with facilities which actually don't even have space for the patients themselves. And you've come, it's a right for you to see your patient, and they tell you there is no space for you. You're supposed to be a caretaker, and there is nowhere to sleep. In terms of the legal provisions, where do I run to if I was late to join? I'm sorry.
No, that is great. That is very interesting. So just like any other crimes, it's very important that if, for instance, a consumer, the rights are infringed, you can actually approach any law related, any legal whatever would take on your case. In fact, it's a very big issue. But if for instance it is a government hospital, it means that it will be ED versus the Attorney General or ministries or whatever. So it's always a legal issue. It's just like the way we file other cases. It is the same way we file these cases. We have gotten successes where consumers actually report their cases as long as they have their lawyer, they document their case very well, and then we have reference to all of these laws because the Public Health Act, maybe the Consumer Protection, whatever, then the Patient Charter, all those laws, they protect consumers. And so it is a legal thing. As long as you have your lawyers, they have documented your case, it is something suable. People can be sued for these things. So it's only that in Uganda or in Africa as large, it's taken like, we don't see these things as cases. But in Kampala, I have seen people being sued for some of those things. So it's basically the way we write, rather the way we submit other cases is the same way we would submit this case. Yeah, I don't know whether that helps, but that is the same process that we would use actually.
Aksha Ntavade, please take the floor.
Yeah, thank you, Mr. Chimera. And thank you, Bernard, for that great presentation. My question, Bernard, how can someone know they're allergic to a particular drug if they have never taken it before or have had any reaction? And I would like to know, how do medical professionals identify or assess such a risk?
Thank you. Bernard.
Okay, thank you, Asha. So during the medical training, there are what we call contraindicated medicines. So for instance, you've seen if a woman is pregnant, there are particular medicines that we cannot give them even when they are the only ones available. So we already know the medicines that are contraindicated in different conditions. Now, there are patients that we observe after they have taken a particular medicine, and then we realize that actually they are reacting on those medicines. Now, if you didn't have prior information and the doctors equally didn't have prior information, it doesn't usually become a case, but what it becomes, you go back to the facility where you received that treatment and register, kind of, not a complaint, but you report that you have been, the medicine that was given to you has caused particular, I don't know what harm it would be, either skin rash or something. And then the doctors in that case are instead supposed to give you health care, preferably for free, to make sure that they support you heal from the result of the medicine. So in such a case, it may not necessarily be a legal case, unless the doctors were aware of your situation and then they gave you a wrong treatment. That one would be like a wrong treatment. The other would be, what we talked about, that you can seek a second opinion, especially for these dangerous diseases. Many times people have been given medication that is actually wrong. Now, in a situation you observe that they gave you a particular treatment, and that is the importance of the medical record I talked about. If you reach home and start consuming this drug, now for you are having malaria, but then they gave you medicine for measles. We have seen those things happen. Someone is suffering from a particular, okay, let's say hypertension, and then they're giving you medicine for diabetes. Now, in such a case, that one becomes a legal case for giving you wrong medicine. The challenge is, how do you now tell, is where the problem is. So in any case, if you went to another hospital and then you say, well, I am feeling like this, but they ask you, when did you last have medicine? That is the question we are supposed to ask. But usually we don't ask, I don't know that it's laziness or something. When did you last go to the hospital? And then they check your previous documents. For many of us of my age, you know that in the previous days, whenever you go to the hospital, they ask you for the last book you went with. The purpose was that they check what was given to you earlier, and if it was the right medicine, they will give you something else. If it wasn't, you can file a case. So those are some of the challenges we meet in the medical profession and whatever. But it is a very good point that you need to think about, and we need to think about how we handle it as well.
Thank you very much, Bernard. You see, ending on that very critical point where your medical history or your treatment history is very key, because as you go in, you facilitate doctors or health service providers to treat you and provide you correct information or correct treatment. If you have got your treatment or medical history with you, those who hold on it can lead to misdiagnosis or wrong prescription. But if you have a good history, like Bernard has said, you are in position for the doctors to know which kind of medicines you've been taking, and with the dialogue, the discussion you have with the doctor, they can tell you that, or you can inform them that when I take this, this happens. When I do that, this happens. Most of the time, some of our institutions or entities do not even have time to ask patients. But colleagues, I trust everybody has done the honors of registering, and I'm seeing the discussions and the products that are coming out on your regional social media channel, on your WhatsApp. People are already churning out information. I would like to thank Doreen for what you're doing with your Toro region. You are really a coordinator and a facilitator. Thank you very much. Keep it up. I know, Marco, you also do that for your region, even inspiring them. I'd like to thank you. I know even Usiku, you do that in the Eastern, and it is we greatly honor you. The colleagues in Kasese, your products are cute. And I will not stop thanking our colleague who did come up with the safer journalism, the guide. So thank you very much. Those are the products that we need to see, and empowering your fellow journalists. So, and then your fellow journalists yourselves, you go up and empower the consumers, and also empower leaders at the local government. Many people, many leaders, many administrators do not have some of this knowledge. So you have got the opportunity to get this knowledge. Please utilize it. I'm signing out, and I'm giving the last word to Bernard, and I'm thanking you very, very much. See you on our next Consumer Justice and Protection series, which I said might be on transport or might be on the financial sector. One of the two will be hitting your platforms, and please get ready for it. Bernard, the floor is yours.
Henry, just a quick one. Thank you. So I have dropped some materials in the chat, but Asha will be reaching out. There's a quick question that I've just seen in the chat. Someone asking whether health workers can inform the consumers about the side effects of medicines. It is professionally right that if we know some medicines can affect particular groups of individuals differently, so it's always recommended that we can tell somebody the likely effects, but those effects are not pseudo, like they may not kill, but we tell you that, well, upon consumption of this medicine, you may have some bit of, you may feel nauseated, or maybe you may become weak, and that's why we keep telling you that please, for this medicine, take it after food, because we know that if you took it without food, it may cause some drowsiness or dizziness or something. But also we can tell you that this medicine, take it just next to your bed, so because we know it is going to cause you drowsy, and so you are likely to doze wherever you are. And then also sometimes we tell you, whenever you come to the hospital, the doctor should be able to ask you for your history and ask you if you're a lady and you're complaining, I have a stomach ache or something. The first thing we shall ask you, of course, we have a number of questions, whether you last had your MPs, when you last had whatever, trying to find out your condition such that we give you medication that matches with your situation at that particular point in time. So it is okay, even with vaccines, we try to inform the public that if you are going to take this particular vaccine, you'll expect the child to spend a whole night crying, you'll expect the child to be weak for 2-3 days, you'll expect this to happen. So sometimes we inform depending on the nature of the medication, and not all medications behave the same way. So we already know that now this one, if you took it with milk, you've had people tell you take this with milk, take this with the other. So those are the things we are trying to look at to help you not suffer the repercussions of the side effects that come with the medicines. So basically, ladies and gentlemen, that is the response to that question. Sometimes we don't tell you, but sometimes we do. Yeah, so sometimes also you feel free to ask the doctor, because that is part of the, what are the potential side effects of this medication? We should be able to give you this information because we always have it. Thank you, colleagues, and we wish you the very best of the week.
Okay, ambassadors of consumers and consumer ambassadors, thank you for the partnership. Like I always say, partnerships deliver life and life delivers partnerships. Let's speak up, let's speak out, and let's raise the voices. Thank you very much. See you next week. All the best, and keep bringing the products, keep bringing the products. Consumer voices matter. Take it. Consumer voices matter. Any service, if it is not safe, speak up. If the good is not safe, speak up. If the services are not safe, speak up. Thank you very much. I wish you a superb weekend. Cheers.